very hungry for it. So let's just jump right in. Let's switch to the presentation. And we want to, not the live video, but we want to go to the share screen. Thank you. I've got my technical support people here. Presentation's over here. There we go. Share computer sound. Yeah. And we're here. And are we good? Okay. Can you see this picture? You know, is the sun going down in India right now? Is the sun going down? Well, the sun is coming up. So good morning from Tacoma, USA. This is the view. I got this yesterday morning. Or yesterday evening with the sun going down. This is a very small lake near where I live. So this is from the great Northwest, and I've spent time in beautiful India. And when you look at the beauty of nature, you can't really always put a finger on what it is that human beings love. But I think that everyone, when you see the Taj Mahal, when you see a sunset, there's something magical about nature. And so we want to really look at what the human eye is looking for. And one of those, like I said, is the elimination of unfamiliar negative space, diastemas, black triangles. So this is also the view from the other side of my room. This is Mount Rainier. It's a beautiful mountain. And it's the icon for our learning center. And we built the learning center to help transition from GV black dentistry to injection molding. Now, people say that we don't do GV black dentistry, but if you go to most dental schools, they're still thinking of making boxes in the teeth and putting the filling in the box. Well, with BioClear, the composite goes around the tooth. We don't cut mechanical retention anymore. We put the teeth into compression, and it's transformational. But it's such a hard journey to go from GV black to injection molding, from GV black to modern composite, that we found out that it was very important to develop a curriculum. These are some of our faculty members. You'll recognize some of these people that post all the time. We have, like I said, we have several doctors that have taken certification training from India also, and we're looking forward to more and more teaching, and hopefully someday having a learning center in India and certification classes. So you'll see some of the work from one of our instructors. These are our learning centers. We have one here in Tacoma. We'd love to have you come visit Tacoma, one in the UK, Sweden, and one that we're building in Egypt at the Raman is building. These are the dental schools in North America that have adopted the BioClear method, that are now teaching the BioClear method in its purity in these different institutions. And so it's a very exciting time to transition away from GV black. These are some long-term outcomes. These are teeth on the top row. These are teeth that were cracked, but instead of doing crowns, we did BioClear overlays and calla lilies to put the tooth into compression. There's an amazing amount of research that's being done that you have access to now. If you'll just email BioClear, they'll talk to you about all the research that's done to put cracked teeth into compression. And that's a 10-year post-operative view of injection overmolding with the BioClear method of teeth that I would have put crowns on years ago. But you know what? People don't want crowns. People don't want crowns. They don't want root canals. They want to save their teeth. On the bottom, here's a 6-year post-op of a black triangle case. So we've been doing this long enough now that the outcomes are as good as porcelain. And so, but we have to change the game if we're going to be successful. So what is BioClear? BioClear started out as a matrix. We were able to put these beautiful shapes into ultra thin mylar, and it slides below the gum line. We're able to push the gums away from the tooth, change the emergence profile, but we have to do it completely differently. We have to heat our composite. We heat the flowable, we use adhesive as a surfactant, we injection mold, we don't do it by hand anymore. We're really not layering anymore because the shape can be so beautiful. And with a monolithic composite that's ultra polished, it sparkles, it's very lifelike, it's beautiful. So some of you have seen this case before, but I wanted to share this because I love this case with the twins. I treated this pair of identical twins and I wrote an article about it, and you can read the article on Dentistry Today and see the video. But you look at these twins and they have this unfamiliar negative space. And you'll notice the twin on the left is actually hiding the darkness between her teeth. She's actually putting her tongue to soften the negative space. So when you start doing photographs, if you see a patient putting their tongue behind their tooth, you might want to ask yourself, is that a tongue thrust, or is the patient hiding the negative space? Because absolute luminescence between black and white is a lot more harsh. So she's softening her negative space by putting her tongue behind there, which is kind of sad. And you can kind of see in their eyes a little sadness with their smiles. And so here we are preoperatively, and that is very harsh negative space. And we want to soften the good negative space. We have good negative space and bad negative space. We want to soften her good negative space. So here we are preoperatively. And so in a case like this, we're not just going to do 2 teeth. We're going to injection over mold all 6 teeth to be able to get a good outcome. These are the matrices that we use in the classic BioClear. These are the diastema closure matrices, the green ones. And in her case, I used a DC202, and I'm going to show you a little bit about matrix selection and management here in a minute. And so here are the matrices. We call this the BioClear aquarium. It pushes the gums away from the tooth. It pushes the rubber dam up, and then we injection mold with heated flowable and paste composite. And here's the preoperative. There's the matrices in place. This is called delayed wedging. You can watch this on YouTube. We'll go in and put a little adhesive and flowable around the edges after we have blasted the tooth and etched it. We'll pull the matrices over, we'll cure that, and then we put a couple of diamond wedges in after we cure the little hip here, the little rim of flowable, and then we injection mold to finish it, and then we get this beautiful tight contacts. And so here we are pre-op, and here we are post-operatively, and the one thing that patients really love about the BioClear method are the specular highlights. Now, a specular highlight is that shiny white that you see in a flash or in natural lighting. A specular highlight, you see the little white areas. And can you see my cursor when I move it around like that? Can you see the cursor? These specular highlights are 10 times whiter than any little hypocalcifications that you might try and build by hand. So to a patient, they don't see this. They don't see a hypocalcification. What do patients see? Specular highlights. If you put the Rockstar polish in, those specular highlights show the form of the tooth. Patients really tune in to specular highlights. That is the conversation that we need to move to. Away from polychromaticity, more to shape and specular highlights. Because who's the boss? I'm not the boss. The patient's the boss. And they love the specular highlights. Here we are preoperatively. Here we are postoperatively. You can see the beautiful little specular highlights on the teeth if you achieve the Rockstar polish. This is a fun video of the twins. The twin on the left, I had treated on Tuesday. The twin on the right is about to get in the chair on Wednesday. So the twin on the left has been treated. The twin on the right is about to get in the chair and do BioClear. She's all excited. And I just thought it was a fun moment to capture. And isn't this the best part of dentistry, is the excitement of changing a life and doing it in a way that's less invasive than we used to do. So here they are preoperatively. They are 13 years old. Who wants to put porcelain on a 13-year-old? Who wants to put porcelain on a 13-year-old? We don't want to do that. Here we are immediately post-operatively. You can see the eyes just starting to sort of sparkle. So here we are pre-op, here's post-op, and now here's a 3-year follow-up of the girls. And then they came in recently, and here's a 7-year follow-up. They're all grown up, driving cars, and they are 20 years old now. So it's a 7-year follow-up, and the teeth are beautiful. They're strong. This has the potential to last for 10, 20, 30 years, maybe longer than porcelain can last, because sometimes when we put a porcelain on a tooth, do a crown, the tooth can break off later. We haven't affected the biomechanics of the tooth. And so it's a new day. Monolithic injection over molded composite is a completely new animal. So here's me. Let's back up. Let's go to the past. This is me with a flat piece of Mylar back when I got out of dental school, and I put a wooden wedge in there, and I thought I was a good dentist, and I took a photograph of it, and I thought, wow, what a great margin. Obviously, I have some more polishing to do, but the outcome, the patient hated it. He said, I didn't come in here with a black triangle, make it go away. So I've spent my life creating a way not to do this to patients because they don't like the look of a black triangle. So, but the problem is my old brain, my old instruments, and my old processes led me to some place it was impossible to move to a modern place without starting over from scratch. Everything had to change when the composite went around the tooth, when we no longer used a wooden wedge to push the matrix against the tooth. We had to get the matrix to fit on its own. I'm going to show this in a minute, where the matrix concealed the gingival margin with no wedge, just with the pressure of the matrix to push the gums away. And once we heat the composite, you'll see how amazing the tooth restoration interface can be. So here's the photo. What do you do now? What do you do now? How do you get the composite in there? How do you disc it back? How do you not have an overhang? What color do you use? These are all the questions that you're asking. But once we built the matrix, now we had an opportunity to reinvent restorative dentistry, and it's been exciting. So we got to move beyond flat mylar and figure out a way to restore these teeth in the new method. So here's the B word, bonding, which we don't do anymore. We don't do bonding because it really doesn't have a very good reputation in the eyes of many patients. So if you're going to do this, you're going to want to call it the BioClear method because patients are looking for doctors doing the BioClear method. They're not looking for bonding. They're looking for the BioClear method because it's been branded as a new procedure. And so I encourage you to use that lexicon, use those words. So here's the BioClear method. Number one, we have to remove biofilm because the composite's going to round the tooth and phosphoric acid does not clean the tooth. Next is modern cavity preparations, which we're not really going to talk about today because it's all additive. In this case, we're going to do a black triangle. And then we have to have matrices that allow the composite to go around the tooth. They have to be smooth. These are anatomic tooth forms, whether it's for a class 2 or for a black triangle. It has to allow the composite to go completely around the tooth when indicated. And then we have to heat the composite. It's almost impossible to get the composite to flow into a little tiny acute interface like that without heating. And then the Rockstar polish. We've got to create the specular highlights because we got to make the boss happy, right? We've got to make these teeth sparkle because then they live and move and it creates something that just has that emotional connection to patients. There's something beautiful about sparkly water, like the slide that I showed, or sparkly teeth. So I'm going to show another case because it's important to see some long-term outcomes. So here's a peg lateral that I treated. Here's the pre-op. About 7% of our population has undersized or peg lateral. Here are the matrices in place, once again, with the delayed wedging that we talked about and injection molding. Here's immediate post-op. Here's a 3-year post-op. Here's a 7-year post-op. Here's an 8-year post-op. Here's a 10-year post-op. Here's an 11-year post-op. Are you tired? Are you falling asleep? Okay, I know it's the same tooth over and over again. These monolithic composites wear at the same rate as human enamel. Now, if you build it in a weak way, it's not going to work like this. But monolithic composite, hey, we're building airplanes up there in Seattle with composite. They're building the whole airplane out of composite now. So they can be strong. It doesn't have to be junk. So here's the patient in 2009. Here she is in 2018. Loves her sparkly little lateral incisors. She's a happy boss. All right. So and sometimes people say, hey, David, can I just do a class 3 with BioClear? Of course. And then we don't completely cover the tooth. So here's an example of the traditional BioClear matrices for some class 3s. I'm going to go ahead and put a wedge in here. We're going to fill one tooth first. I'm going to fill the lateral. Then we take the matrix off, leave the wedge in there, and then we're going to do the central incisor. So the composite is going to basically cover half the tooth, maybe a third of the tooth, but still with an infinity edge. But what I want you to see is how long the contact is. We want to have long contacts, not point contacts. Nobody wants a point contact anymore. They're unhealthy, you get food impaction, and they're ugly. We want big, broad contacts. It's the new aesthetic. And there's another view from the lingual. We basically etch to the edge of the matrix. I'll show you how to do the finishing. This is just quick, easy class 3s. It has a nice infinity edge. They're very resistant to stain, and the patients love them, how smooth they feel. So that's just a basic class 3 done with the BioClear method. So yes, we can do a more simple version of BioClear, but I don't do bonding. We injection overmold every restoration. Once you get good, it's pretty fast to do. So we have all these challenges with composite, breaking inside the ledges, poor emergence profile, stain, class 2s where the teeth are breaking and needing root canals. So we are not without our problems with traditional composites. And that's why we've had such a good time sharing the BioClear method, because people say it's life-changing to be able to injection overmold a tooth without using a crown. We feel better if we don't have to cut the tooth down, don't we? So we're going to talk a little bit about black triangles now, talk a little bit about patient preferences, and then I want to get to the live demonstration here on this Dentiform. We're going to show you matrix selection and write all your questions down, because we will answer them as we get to the wrap up. So why is this such a big deal? Why are patients so concerned about unfamiliar negative space? So what do you think that the first thing the patient would say about the space? They come in, they go to the internet, they see that that BioClear can treat black triangles, and what do you think the number one complaint is from a patient? This makes me feel blank. This makes me feel blank. What is that? Old. We have a youth-driven culture. So the first thing that people say about these black triangles is it makes me feel old. They also say it looks like I have gum disease, even though they may not. 30% of adults have black triangles without periodontal disease, but it looks like a disease. Also, it looks like they don't take care of themselves. Neglect, poverty, lower IQ, genetic disorders. These are all the crazy things that people say when they come to me, because I've done almost 1,000 black triangle treatments. This is why I hate my black triangle. These are all the things they say. And then one lady says death. It's like, what? Black triangles look like death? Well, yeah, I had a patient say that. And then I looked at the skull and I said, oh, no wonder. Absolute luminescence, black on white, is the most powerful contrast that we have. And a black triangle is that same thing, white on black, and this looks like death, okay? And we're all probably a little bit afraid of death, okay? That and politics, right? And COVID, maybe. All right, so, but we're definitely afraid of death. So look, if you look at some of the research regarding black triangles, it's pretty interesting. Here's a research that was done on black triangles, and black triangles are ranked 3rd among all these aesthetic defects, above crowded teeth or dark teeth. Now listen to this. Black triangles are uglier, and diastemas would be the same thing, than crowded teeth or dark teeth. And so I know we've done a lot of bleaching and a lot of veneers to make teeth white, and we've done a lot of orthodontics to move the teeth around. But to the patient, to the boss, what's the ugliest thing? Negative space, bad negative space, gaps, black triangles. Why haven't we been doing more of this? Ask yourself, why haven't I been doing more black triangles and more diastemas? Because we didn't advertise it. So once the population understands that we have a beautiful treatment, they will ask you for the treatment. But you have to create awareness that we have a solution. Hey, nobody asked for bleaching 50 years ago because we didn't have bleach. So what created all the excitement for bleaching? We did. Okay, because we knew that people liked white teeth. You've got to create awareness. You have to say, we're doing the BioClear method. We're doing injection molding. And then they'll ask for it, okay? These are the patients that have flown to my office from all over the world asking for BioClear treatments. So, I have a lot of, like I said, lots and lots of folks in India really are looking for BioClear providers. So here's the bonding. This is something that, doesn't look that great. Here is what bonding looks like on an x-ray, which looks, hey, I've been there. I tried to patty cake it in there. It's not healthy. It's temporary, right? There's BioClear retreatment, where the composite goes around the tooth, completely ensconcing the tooth. And isn't it beautiful? Simple, strong, and healthy. So let's take a look at a case. So here's Dr. Pat Retzer. He came in and he wanted black triangle treatment. So one of the things I wanted to share with you today, this is a case I haven't shown before. Patient comes in and says, hey, Dr. Twinkle, I want my black triangle closed. And then you have to be the parent. And you say, okay, Pat, I know you want this black triangle treated, but I'm also the boss and I'm going to take photos. Because this guy, he's a dentist. So he thinks he knows exactly what he needs, right? He says, I want one black triangle treated. I said, okay, but let me take my photos. So when you take a look at all of the other treatments that we could do to take care of black triangles, these are all of the things that you'll see in the literature. But a lot of these things patients don't want to do. And sometimes orthodontically compacting the arch is going to create Bolton discrepancies and other issues. So a lot of the stuff that we did in the past to treat black triangles, patients really don't want or wasn't maybe the right treatment. So we can do subtractive porcelain. Hey, we can do porcelain veneers, but most patients would choose not to have their teeth ground down, especially to close a black triangle. So this is falling out of favor with patients. They don't want veneers to treat black triangles. No way. How about bonding? Well, it's got a bad reputation, right? So here's how we tried to simplify this. In the past, we could do bonding. And we said, well, it's inexpensive. It doesn't last very long. We can try it. But it was not very inspiring. And then we said, hey, we'll do something amazing. We'll do indirect ceramics. We'll grind your teeth just a little bit or a lot, and we'll do these porcelain. And we got excited about it, but the patients were a little less excited. Well, today we have a third option, and that option is the BioClear method. Or you can call it injection mold remolding, whatever you'd like. It has advantages physiologically because we don't have to cut the teeth down, but it has most of the advantages of indirect, of porcelain with strength and beauty. And a lot of doctors doing BioClear are charging a fee that's more like porcelain. It's not down here with the bonding fee. It's close to their porcelain fee because it takes some work and training and some materials. And so if you elevate your outcome and are talking about 5 and 10 and 20-year outcomes for beautiful restorations, your patients will pay a fair fee. And that fee can be close to what we do for porcelain. So we're going to be talking about, I've shown you some of the matrices from the classic BioClear. We're not going to be talking about the 360 veneer matrix, but I just wanted to put the picture up there. And now we're going to be talking about the black triangle matrices. These are fairly new. They're about, Tanya, how old are these matrices? About 2-3 years?
Yeah.
We've had the black triangle kit for about 3 years, I think. And so this is a specific kit that's super easy compared to the original BioClear. Original BioClear was fine for black triangles, but this is so much easier. And the matrices are specifically made for black triangles. Now, other people use them for class 3s and diastemas too. So you can use them for almost everything. But we're going to be playing with the black triangle matrices now. So here's the kit. Here's how it works. There are 2 sizes of matrices, small and large. And then there's 4 colors with each matrix. So a large matrix would be for a central incisor, a canine, or lower canine. The small matrix that you see over in this tub would be for lower incisors, maybe a lateral incisor. And then there's 4 different colors. We put the gauge between the teeth. It's a good guide, not 100%, but a good guide for what size you use. These are all the instructions that come in the kit. I'm just running through these because I want to familiarize you with the method. If you're interested, it's good to take a class for sure. This is all the information that comes in the black triangle kit. So each step is very prescriptive. And so back to Pat. So he wanted his black triangle closed between 8 and 9. So Twinkle, you're the doctor, okay? And the patient says, well, I'm a dentist. I want my black triangle closed. And you're going to say, no, we're going to take some photos. You know, he's already have his treatment plan. I want one black triangle done. Well, there it is. It's pretty big one, isn't it? He hated it, right? And I said, hey, we're going to take some photos and look at the photos. Look what else is going on here. Look at that black triangle. He didn't even know he had that black triangle because he looks at the mirror like this, not like this. So I said, Pat, no way am I doing this one and not that one. because someone's going to look at your case and say, oh, you went to Dave Clark and he left that other black triangle. What's wrong with him? So I said, no, Pat, we're doing 3 black triangles. And we even took off his porcelain veneer. I'm retreating some porcelain veneers with BioClear because porcelain veneers can sometimes stain in the interproximal. Well, BioClear goes around the whole tooth. So BioClear can look prettier than a porcelain veneer sometimes. This is the smile design gauge. We also noticed, did you notice that one of his teeth was bigger than the other? Can you see his number 9 is actually bigger than his number 8? It's important to go through this process because once you're done, the patient needs to understand, hey, this one tooth is bigger. Do you want to change it? He said, no. Well, that's fine. That's informed consent. He says, leave my midline where it is. Okay, great. So we went in, did the case, going through all the measuring. What does the patient want? He wants BioClear, he wants it natural looking, and he wants a 5-year warranty, which is what we give for BioClear. I said, okay, great, let's go. So what's the treatment plan for Pat? We're going to do 3 black triangles, not 1. We talked about moving his midline over. He didn't want to do that, so we left the midline, and the 2 teeth will not be quite the same size. That's his decision. We took the porcelain veneer off one of the teeth, and then we do what's called a root overlay because the porcelain went near the root. And so that's the treatment plan for Pat. Here we are with the gauge. And here we're going to be showing removing biofilm. Except my video won't play. So imagine me blasting and removing biofilm, all right? You can see the video on YouTube. Now, what we're going to be doing when we build his case is, when you do black triangles, we want to, especially most of the cases, you should be doing multiple teeth. We like to do what's called the aquarium. So I've got the aquarium on tooth number 8, and then I have a shield matrix on 7 and a shield matrix on number 9. That shield matrix is going to do 2 things for me. Number 1, it's going to maintain the midline where it currently is. It's like a diagnostic wax up, because as we injection mold, the teeth can swell. So that shield matrix, or the matrix on either side of my aquarium matrix, is going to protect the other teeth also from getting adhesive and flowable and that sort of thing while I'm doing the main tooth. So here's my aquarium and my shield matrices. There's the first tooth. Look how square the contact is. It looks kind of weird right now, doesn't it? It's a new shape. That's the first tooth. We take it to 80%. Then we do the next tooth. We put an aquarium on the next tooth and then a shield over on the one to follow. But now I don't need to put in a shield matrix on the tooth that I already injection molded. And then we go to the next tooth. Now I am mixing the 2 matrices here. I'm using a black triangle matrix on the mesial, but then because I was not going to be closing the black triangle in the distal here, I just put an aquarium. So you can mix and match the matrices depending on what you want the aesthetic to look like. There we go. There's the final tooth. And so we're ready to injection mold. That's a combination of the black triangle matrices and classic BioClear. There's immediate post-op. There's a Rockstar polish. I told Pat, I said, do you want me to leave a little black triangle? He says, no way. I hate my black triangle. And I said, Pat, your teeth are going to look rectangular. And he said, are you listening to me? I'm the boss. I don't want any black triangle. I want it gone. I hate my black triangle. So the boss said, use the blue, which is the most curved of the matrices. So I did. And there's his immediate post-op. And when you look from far away, I had one of the people said, he looks 20 years younger. So that is a patient-centered outcome. Now, somebody would say, hey, Dr. Clark, I don't like the shape. Hey, Dr. Clark, blah, blah, blah. And guess what? The patient loves the result, loves it. It's healthy. It's smooth. It's going to last hopefully for 20 years. It is a new aesthetic. I can't make it perfect, but I can make it a lot better. I cannot make it perfect, but I can make it a lot better. And we didn't cut his teeth. He didn't want his teeth cut down. He's a dentist. There's the post-operative radiograph. It's beautiful, healthy, flossing. It is a whole new game. These are better margins than you can get with porcelain. These are better margins than you can get with gold. I love gold, but that's a better margin than gold. And here's Pat. He's happy, right? That's the postoperative photograph that matters the most. Your selfie. Do the teeth sparkle? I can see from all the way over here that that tooth is sparkling. There's a specular highlight right there. Okay. So what's the most important thing? To put photos on Facebook with the tooth blowing up this big, or to have a happy patient? You're going to have to decide who the boss is. My boss is the patient. My boss is the gum tissue. My boss is not harming the tooth or the pulp. Those are my bosses. So as far as the etiology of black triangles, there's so many reasons that black triangles can come along. I think it's important to explain to the patient that it may not be because they were, that they were a neglectful patient. So these are many of the things that can cause black triangles. These are some of the problems with black triangles. It's not just ugly. You have food impaction. You have post-orthodontic instability where the teeth with a point contact, they're not stable. So if you have point contacts, those teeth are going to have orthodontic relapse. With the broad contact, they're not going to relapse. So finishing your cases with the BioClear method is going to help to stabilize the teeth. It reduces mobility in periodontally involved teeth and solves a lot of other problems that you get with black triangles, phonetic issues, all these kinds of things. So these are all some of the benefits from black triangle treatment. Now it is 8:09 and we have until, we started at 7:30, so we have until 9 a.m. my time, right? 8:50 and then 10 minutes to wrap up. Yeah, so I think we're doing really well on time. What I'd like to do is I'd like to stop and do the live demonstration on the dentiform, because I think some of you are falling asleep. So, so let's go ahead and do a live demonstration now. So we're going to switch the input to the camera, and let me go ahead and go through the whole process of how we do injection molding and matrix selection, because that I think people are excited about this. I think they really want to know how to do it, sometimes more than why or what the science is. The how is really important to people. All right, here we go. So we're going to be looking at our patient of the day, and it's a little bit like Pat's case. It's a huge black triangle. Now, Dr. Twinkle, can you see this? Yes? Okay, so here's the case. And so what we typically will do is we will go in, and this comes in the kit. This is a true contact saw. We'll go in and we'll make sure that the contacts are groomed so that the matrix will slide between the teeth without getting stuck. And then we'll take a single side abrasive on these teeth to make sure that the matrix will slide easily between the teeth. We're not opening the contacts, we're just sanding them. And then on a back-to-back contact, we'll go ahead and sand that. So once we've done that, then we're going to go in with our black triangle gauge. And we're going to want to bring the gauge from both the facial and the lingual. You'll notice that it binds a little bit differently on the palatal, and that's because the palatal is more constricted because of the arch form and the tooth shape. So it's somewhere between a blue and a green. And then we take a look at some of these other spaces. That would be a green. This would be a pink. This would be a yellow. This gauge will help you decide which pair of matrices to use. And then, like I said, we have two different sizes of matrices. We have large and small. This would be for lower incisors and maybe a lateral incisor. This would be for pretty much everything else. So let's go ahead and take a look here. We were gauging a blue. So I'm going to go ahead and grab a couple of the blue matrices. Here we go. And we'll try those in the midline. So let's take a look now. Now I'm going to treat the patient. I'm going to put them upside down like you treat them. And we're going to rotate the blue in. It's important to rotate the matrix in like that and rotate the matrix in like that. So let's, I'm going to ask, I'm picking on Dr. Twinkle. Dr. Twinkle, okay, I want you to tell me, do you like that shape or should we try the green? What do you think?
So it looks good.
You like the blue, okay? So we're going to stick with the blue here. And then this one was gauged over here as a green. So I'm going to try the green in here. and see if I like that on the distal, because I'm going to get my aquarium built here. And we're going to start with the lateral. Start with the central. So I'm going to put a green in here, and this is kind of my diagnostic wax up. And I look at that and I think, you know what? I think that I like the mesial, but I think the distal is a little bit too convex. I think it's going to look too large. So it's okay to go what we call off label. So what I'm going to do instead, because I think the yellow would be a little bit better shape, I'm going to take the green off, and then I'm going to try the yellow instead, and then I can compensate for the lack of curvature here. Make sure you only use one matrix. You won't get a good contact if you have two here back to back. So I'm going to try in a yellow, and I like the yellow a little bit better. I like that shape better. So I'm going to have to add a lot of volume on the lateral. So on the lateral, that's a pretty small tooth. So I'm going to use the small on the lateral incisor, but let's go ahead and use the green, because that I need a lot of curvature to close that space. So this is the small, and you'll see the difference here with the small matrix. So I'm going to bring that in. And what do you think? I like that shape better. Now, you can ask your patient, because they could actually look at it. So I think I'm going to go with yellow here and green here. So I'm going a little bit what we call off label, because artistically, I like that shape better. Twinkle, what do you think of my choice?
It's good.
You're good? Okay, Twinkle says it's okay. It must be okay. All right. So now we're going to go ahead and injection mold this tooth, and we'll quickly sculpt it and go through the whole BioClear process. Now, obviously, I would do the entire arch. It can go very quickly. So we're going to go ahead and go through the injection molding process. So we would disclose and blast this, and then we would etch the entire tooth. Let's go ahead and do that now. I can have some phosphoric acid. So we're going to go ahead and etch the tooth, and we're going to do a total etch. We don't really, selective etching is something we really don't do anymore. It's not going to work if we're doing the BioClear method. So we use 3M materials because we like the Scotch-Bond Universal, because it's no problem to do total etch. So I'm going to etch, and we call this the aquarium. Now it makes sense. So there's my aquarium. We don't have any goldfish in the tooth aquarium, okay? Just acid etch, all right? So anyway, so we're going to go ahead and etch for about 10 seconds.
Sorry.
And you can see how well controlled we are with the aquarium here. Make sure all the etch is gone. What's that? Okay, thanks. All right, so then we're going to go ahead and dry. So there we are. Actually takes longer on the dentiform than it does in the mouth for some reason. So here we are, dry, ready to go. I'm going to bring my filter in, and now we're going to take the Scotch-Bond Universal, and we're going to go ahead and, because we do not have a significant amount of dentin tubules, I'm going to be able to injection mold without curing the adhesive first. And I know people will have questions about this, so make sure that we answer this at the end. So I'm going to massage the Scotch-Bond Universal, because there's a little bit of dentin here. I'll massage that for about 20 seconds, which is how long it takes to wet the dentin. And then for all of the enamel areas, let's assume that the rest of this tooth is enamel, I'm just going to get this big bender brush and bring in a large volume of adhesive. Let me have the big scrubby. We'll do it for the lingual. So you have to kind of pick whichever brush that will fit in your BioClear aquarium. There's a real advantage to having the matrices completely ensconce the tooth, but it does create some challenges to get the adhesive everywhere on the enamel. So now we've rubbed it into the dentin for 20 seconds, but because we have such a small amount of exposed dentin, we're not going to cure that independently. We just have to air thin to drive off the surfactants. And now we're going to take heated flowable. So this is the heat sink heater. I can just shove it under here. This is the heat sink heater. It's a big old monster, and it's got all of the composites in here. It's got the flowable and the paste. I'm going to bring in the heated flowable, and I'm going to angle it at about a 45 degree. I'm going to bump up my magnification here so you can see this. We want to inject slowly. Let the heated composite, flowable composite, go around the corner. Slowly. And then we're going to coat the contact. Then I'll do the same thing on the mesial. Watch me. I'm bracing the matrix with my fingers. You want to hold it from the incisal, not the lingual. And then I'm going to inject from the lingual, and I'm always injecting into the composite that went around the corner. So I'm going to put this into the flowable, just like so. And I'll fill the lingual. It actually is quicker for finishing just to fill the lingual entirely. Now you could stop now and just do the flowable, but in reality, the paste composite is stronger. It has better shine retention because the Rockstar polish and the specular highlights are so important. So we're going to use paste. I'll inject here. I'm about a half a millimeter off the tooth. I'm pushing the paste ahead of me, just like this. That's going to displace nearly all the flowable to the lingual. We don't mind having flowable on the lingual. And then we're going to take our spatula, and we have to massage the matrix back. There's another reason to use a shield matrix. Can you see, Twinkle, that this matrix is more distended? Can you see it's away from the tooth? That's why we use a shield matrix as a guide. If we don't massage this back, it will change the emergence profile, and it will have a weird contact. It won't be a good contact. So the matrix is distorted when you inject. You have to remove some of that composite by simply massaging the matrix. And then we're going to take a dry brush. We'll come in here, and I have my dry brush. And the dry brush is simply to remove the flowable that's gone on the wrong side of the matrix. You'll see a lot of this in the mouth sometimes. On the stenoform, we are not having a lot of excess, but now you see why we want a shield matrix, to keep the material off the neighboring tooth, and now we'll cure. So one of the things that we've been seeing is that if people are not curing their composites completely, they're not color stable. Now, I know that they sell these 2-second curing lights, these turbo lights. 3M is very specific about this. Go ahead and take your shield away. They're very specific about this. You have to cure the composite for 10 seconds on the facial, 10 seconds on the lingual in each area, no matter how powerful the light is. So you really don't want a light that's more than about 1,200 or to 1,500 milliwatts. If it's any higher than that, you're just overheating the tooth. The composite takes time. The 3M composites and most of these composites take 10 seconds. 10 seconds on the facial, 10 seconds on the lingual. I did some cases with the turbo light and the color was not stable. We only cured it for 2 seconds. So let's make sure that we're giving the composite adequate time to polymerize. Now, we're going to take our shield matrices off, like so. And then we would use these later as an aquarium matrix. This is the Clark Explorer. It's important to have an Explorer that's very sharp and very stiff to remove the matrices. You can see it comes away from the tooth cleanly. This composite has the same compressive strength as Emax Millable. Did you hear what I said? Monolithic Filtech has the same compressive strength as Emax Millable, which is a ceramic that we really trust. So there we go. Now, how do we finish a tooth like this when we've completely ensconced the tooth? Now, I know right now some of you are freaking out because there's so much composite, right? Hey, when you mill a crown out of zirconia, how much of the zirconia gets wasted? Most of it. So yes, this procedure is elegant, and that's why it should not be a cheap procedure where you're worried about using a little bit of composite. Your patients don't want you to do a cheap procedure. They want BioClear. They want something that lasts. This is an alternative to crowns, and it better look as good as a crown looks, hopefully better than a crown. Okay? It's all about value. Hey, I've been to India. I see these signs selling Maseratis and jewelry and Prada shoes. I know the people everywhere have money to spend on good quality stuff. All right? Okay. Let's go ahead and we're going to go through the sectioning process. Once again, this is a very quick tour of BioClear. And if you're, like I said, if you're interested, doing a class would be super helpful. Our job is for you just to see the whole thing in action. All right, we're going to section this back 1 millimeter, no more, no less from the tooth. That's about where we want to be. And then we'll take a look on the facial. I'll cut back here 1 millimeter from grade. 1 millimeter from grade. And then we do all the final sculpting with our SoftFlex XT disc. Am I centered here, Bryce?
Sure.
Cool. All right. There is no minimum thickness for composite in compression over enamel. I will repeat that 3 times. There is no minimum thickness for composite in compression on enamel. This entire lingual is in compression, so it doesn't matter how thick it is here. We're not restoring the incisal edge, so there really are no requirements here for thickness on a black triangle. We're going to bring the SoftFlex XT disc in just like this. And we're going to bring it to grade. You have to tip the disc at about 15 degrees to the lingual to simulate the wear pattern of a maxillary incisor. I'm very close to grade. Now I'm going to take the disc and invert it. We'll come on the facial. We'll do 3 planes, 1 on the incisal third, 1 in the middle third, and then the gingival. I'm maintaining my mylar finish. If you can see the mylar finish, it's covered with powder. That mylar finish is to be left alone. This is what we call your umbilicus or umbilical cord. Just like with the baby, you just cut the umbilical cord off and that's it. The baby is perfect. All right, so here we go. So the disc is now in its worn state. I'm slowing down. And that's the general idea. Make sure and remove all of the deep scratch marks with the SoftFlex XT disc. I'm just about ready for my Rockstar polish. You know, it's a little bit early in the morning. I kind of gouged right there, didn't I? Don't tell anybody. It's early here, okay? All right. And then we're going to go ahead and round our incisal embrasures. I'm actually going to do a little bit of an augment there because I've actually kind of made a little mistake. I'll pretend that I meant to do that to teach you about how to do an augment. We're going to roll the incisal third in. You cannot add a lot of volume in the incisal third because that's going to violate the neutral space. So I'm going to pull that incisal third in. And now I've got a really nice looking tooth because what the patient wants is a rectangular tooth to take away the black triangle. So yes, the shape is going to be a little bit different. We really have no choice but to add volume. Let's go ahead and do a little bit of an augment there since I got a little bit wild with my disc this morning. Now, this is the same thing that you would do if you had a void, and everybody's going to have a void now and then. In the composite, you don't need to do anything. You just put adhesive on there. There are plenty of methacrylate sites to bond to. I'm going to go ahead and cure the flowable and the adhesive together. Make sure and add enough volume to cover your little mistake or your bubble. So I'm going to add enough volume to take care of that. Let's go ahead and cure that. And I'm not going to give it the full 10 seconds because I don't want to waste your time. So clinically, that would be 10 seconds. And then I'll come back in here. I'll be more careful this time, Twinkle. I'm not going to make any mistakes, all right? Enough people are watching here, okay? So I'm going to come in here and not make a mistake. And there we go. All right. Now you see we have a little bit of natural enamel that's showing right there. You know, you can completely veneer the tooth if you want. I think you'll be interested to see that little area of natural enamel. If we wanted to opacify a dark tooth, obviously we would leave more volume there. But today, we're just taking it back kind of close to what we call the natural grade of the tooth. All right, let's go ahead and do the Rockstar polish quickly. So to do the Rockstar polish, we're going to use what's called Magic Mix, and then we'll finish it up with the Rockstar polisher. The Magic Mix is going to remove the deeper scratches. It also helps to round the incisal edges. So we're going to go through the Magic Mix phase, and then we're going to go to the Rockstar Polisher, which is a diamond impregnated cup. Now, some of these things are not necessarily available in India yet, but we're building our dealers in India, and we have some great folks, great dealers now that do have some of these BioClear things. And so hopefully we'll be able to get the magic mix rolling here. So if we can't get the magic mix working, there we go. All right. And magic mix, please. So the magic mix is some coarse aluminum oxide and some very fine particles of aluminum oxide. And so we're going to use this in a disposable cup. And you grab some of this aluminum oxide, this very coarse and then fine mixture of aluminum oxide. We'll put some on the vestibule. Thank you, Tanya. And then we'll take this across the surface at about a medium speed. We're going to be grabbing fresh magic mix every few seconds because it depletes quickly out of the cup. This is a little bit like using propy paste, really. And then we'll rinse that away. And we'll go to the Rockstar Polish. So let me go ahead and have the Rockstar Polishing Cup. Now you'll see a little bit of difference in the value or brightness of the composite because these deniform teeth are sort of crazy white. We'll take this in the dry phase at first, and then we'll stop and go to the wet phase, which we're going to do now. So let's go ahead and do wet. So this is the Rockstar Polisher. It is diamond impregnated. And these are autoclavable, and there are other diamond impregnated cups out there you can try. But this is specific for the BioClear method. And what we want to create is that beautiful specular highlight. And let's stop now. Okay, so can you see that sparkle, Dr. Twinkle? Does that sparkle pretty enough? Okay, I think we're there. All right. So I just wanted to go through and demonstrate how the BioClear method works live, how simple it can actually be. And I think it's nice just to watch how the whole thing comes together. No, the problem with lectures is it looks good on the screen, but then you go to the clinic and you say, well, how do I do this? So it's good to see it live. And then hopefully you'll have a chance to play with some of the classes that are being done around the world. So let's go ahead and go back to the share screen. We'll show you a couple of cases, and then I'm looking forward to all of your questions. I hope nobody's fallen asleep here on me. Apparently you've been in meetings all day here, is that correct? So I think the sun is just coming up here in Tacoma. All right, so we talked about some of the benefits of elimination of black triangles and negative space. And like I said, we'll show you a couple of quick cases. Here's one of the doctors. Just a simple case done by a doctor in Texas who did the injection overmolding. This was his first BioClear case, Dr. Michael Scott. Here's Dr. Richard Yon. He did a black triangle case where he covered the entire tooth and then disc it back just like we teach. This can be very quick. You can do these in half an hour. You can do a black triangle in half an hour once you get good. Now, I like taking a little more time, but some of these doctors can do them in a half an hour. And it's very simple to actually cover the entire tooth if you're doing comprehensive treatment. Now, if you're doing a class 3, you can do half the tooth. But if you're doing an aesthetic upgrade, it's actually faster to do the whole tooth. So if you want to finish these orthodontic cases on adults, a lot of these need BioClear. So here's a woman, we talked about preferences. This is from the internet. This is a woman who was on the internet saying, hey, I'm in the middle of orthodontics. I have a black triangle. I hate it. What can I do? She says, I would rather have crooked teeth than black triangles. Now, does that surprise everybody? Here's a woman in the middle of ortho. I just grabbed this from the internet. She's getting black triangles and hates them and says, I would rather have crooked teeth than black triangles. Now, the research tells us she's not crazy. So we need to begin to do informed consent on every orthodontic case and say, you may get black triangles. And if you do on adults, then we have a beautiful treatment that we can do. But we have to tell them in advance. And that's the new informed consent, basically. I want to show another long-term outcome. This is an orthodontist that came to see me, had beautiful teeth. She hated her black triangles. We ended up doing 14 black triangle treatments on her. So here's the immediate post-operative. You know, it's a different shape, isn't it? Some people say, I don't like that shape, Dr. Clark. And here's what I say, I don't care. Because the patient loves the shape. And who's the boss? Who's the boss? The patient, right? Here's her 6-month post-op. Here's her 6-year post-op. Do you see any stain in there, Dr. Twinkle? Do you see any stain at year 6?
No.
No. And that's what happens when we injection over mold and use the BioClear method for polishing. We don't see stain. And people, you know, they eat a lot of things in the United States and India that have stain. So we have to build something very safe. And when you do the Infinity Edge, it's a lot more stain resistant than bonding, because bonding, man, the margins always stain, right? And so here are the pre and post-operative radiographs. Pretty exciting. Now, why does it fit so well? It's the BioClear method. You have to use the adhesive. You have to heat the flowable. You have to heat the paste. So adhesive as a surfactant, heated flowable, heated paste. And yes, you may have some x-rays that don't look this good. It means you have to learn more, understand the matrix, make sure the matrix is fully seated. You'll get very good at this if you keep going. Once again, this is the kit. These are the instructions. There's another case I'm going to show you. I'm going around putting the gauge in. We have to remove biofilm. Phosphoric acid does not remove biofilm. We'll blast it, sand the contacts, put the matrices in. Here's my aquarium matrices. There's my shield matrix. Then we just go around. You can see the power of the shield matrix to help stabilize the teeth and to make the procedure go smoothly. Look at that beautiful fit under the microscope. Isn't that beautiful? My heart goes pitter patter when I see that. I love this stuff. And I'm crazy, I know, but it is so beautiful. There's my aquarium matrix. Then we go to the next tooth. There's the small. These are the small matrices that we showed you. They're either large or small. In this case, lower incisors, small, and then whatever colored we need to fill the embrasures. Rockstar polish system, there's the components. Show you another crazy case by Dr. Charlie Regalado, one of our instructors. I hope you get to come to Tacoma someday and meet the famous Dr. Charlie Regalado. Annie had severe black triangles. She came from the periodontist office and said, I didn't want to have my teeth extracted. They're now stable. They're not very mobile, actually. Her periodontal disease has been very well controlled, but now she has terrible black triangles. And you look at the case and you go, what am I going to do? Right? And this was one of his first cases. Charlie was freaking out. He was nervous about this case. And so, but he really didn't have anything to lose. She was in tears. She wanted a treatment done. And Charlie said, okay, here we go. So there they are. That's a fair amount of dentin, but if you follow the protocol, we can bond to dentin. He's trying the matrices in. This is with classic BioClear. You can do black triangles with classic BioClear with the original. So either way, but the black triangle kit is a little easier and there's more flexibility and more shapes. So anyway, there's the immediate post-op. He only added 0.2 of a millimeter to her teeth. That's all you have to do. You don't have to make them thick. You can make them thick if the patient wants white teeth. This patient didn't want any whiter teeth. That composite there is only 200 microns thick. It's nothing. But if you do the whole tooth, can you see how it's going to be stain resistant? And because it's in compression, it's not going to chip. So there she is. So what do you think? Does it look okay? I think it looks a lot better. Here's her 2-year follow-up. Look at that, stain resistance. It's amazing. Now, Charlie Regalado, he's got good hands, but Charlie will tell you, hey, you can learn this too. Just follow the recipe. And look at her eyes. Can you see the difference in her eyes? How their eyes just sparkle. So here's her preoperative radiographs. There's her postoperative radiographs. They look like tennis rackets or something, don't they? Or do you guys play cricket? Are those like cricket rackets or something? Maybe it looks like a cricket racket or something. I don't know. So here it is with their cricket rackets or their tennis paddles or something. That's amazing. And then you say, is this healthy? And the long-term outcomes tell us that it can be very healthy because we have less food impaction, there's less calculus accumulation, but it has to be smooth. And we're not going to do this on uncontrolled perio patients. If the patient has uncontrolled perio, don't do BioClear. Get them under control. And here she is pre and post-op. Isn't that amazing? What a life changer. Now, she's not going to have those teeth for 50 years, but she may keep those teeth for another 20 years. And every day she's going to enjoy how beautiful they are and what a life changer that he did. And here's the neat thing. He did not cut her teeth whatsoever. He did shorten the incisal edges. He did shorten the incisal edges just a bit, but that's not going to impact anything long-term. And look at that outcome. So yeah, it's a different shape and it's a new game, isn't it? It's a brand new game. So this is a neat video that I would recommend you, this is on YouTube. If you Google it, it's BioClear plus 3M. I hope this video played because the other one didn't play. Oh, here we go. Did you hear this? It has a little music. Okay. So just watch along and I'll explain it in a minute. So that is something that you can have your patients watch. I know that it's a technical video. I know that that's a technical video. Patients love technical videos. So I actually have a link on my website from the BioClear Clinic so patients can watch that to see how beautiful the science is behind the BioClear method. And you know, what's interesting, like I said, we have a YouTube video that has 1.3 million views on closing a midline diastema, and half of those views came from India. Half of these 1.3 million views came from folks from India. And I think most of those people are patients, not doctors, reading about the BioClear method. So I think there's a huge opportunity for the folks that want to get good at injection molding with BioClear to make that a part of your practice. And it's fun. That's the best thing, it's fun. So we're back to my sunset here, the specular highlights, the shiny stuff on the water. And like I said, this is the view from a little lake where I lived this morning. And I thought I'd share that all with you, give you kind of a taste of where I live and a little taste of the BioClear method. So we have 15 minutes for questions. So let's have at it. So what do we do now?
Yeah, doctor, just stop the screen share. Yeah. It was a wonderful presentation by Dr. Clark. And we would now ask some questions which we have received from the audience. The first question is, would it be not easier to etch bond and then apply the BioClear, or you would prefer applying BioClear and then doing etching bonding? If that, and what is it?
That is a great question. I get that all the time. That's a perfect question. So in the past, we would maybe etch and adhese and then put the matrix on secondarily because we didn't want to have a buildup of the adhesive. But one of the things that the first time you use BioClear, you'll realize something, that as the matrix goes into the tooth, around the tooth, it will push the gums away from the tooth by up to 2 to 3 millimeters. So if we etched an adhesive before the matrix, you're going to have a zone of tooth that's subgingival that you didn't have etch or adhesive on. Now, in the old days, our matrix didn't reflect the soft tissue. The BioClear matrix is like retraction cord. It literally pushes the gums away from the tooth all the way down to the attachment. And so you have to put the matrix on because you've uncovered so much tooth. And remember, where do we want to change our emergence profile? Where do we want to change our emergence profile?
Right.
Supragingival or subgingival? You tell me.
Subgingival.
Bingo. So that's a perfect question. Thanks for asking it. I hope that's the right answer. I hope that answer makes sense.
Yeah, Dr. Twinkle.
Yeah. So one more question is, how do you handle inflamed gingiva when you place the matrix?
Well, number one is we need to make sure that our patients are stable before we do fancy BioClear. Now, if I'm doing disease control, let's say the patient does not have good hygiene and I'm just doing class 3s. And I'll do class 3s on patients that have poor hygiene because we have to get the disease under control. So if I have a patient who has bleeding, one of the things that you'll find that's very interesting is as the matrix goes subgingivally, it actually puts pressure on the gums, like direct pressure to stop bleeding. So we actually get less bleeding with the matrix because you can see how it pushed the gums away. And then if I continue to have bleeding in spite of a rubber dam and in spite of the compression of the matrix, we actually will, while I'm etching, where there's blue in, you saw how I put the blue etch inside the matrix, I'll take astringent, ferric sulfate, on the outside of the matrix at the same time that I'm etching the inside. So you can do two things at once. So if I get bleeding, which I don't get that much of, you'd be surprised with the way the matrix sort of compresses the gums, I'll actually put astringent on the outside of the matrix. So there's a kind of an orange on the outside, kind of have a visual, orange on the outside, blue on the inside. And so, but one of the problems with a normal Mylar matrix, it's flat, it cuts the gums. So Mylar, and normal metal makes the gums bleed. BioClear controls bleeding because compression is the best way to stop bleeding. So those are the two ways that we do it. That's another great question. Because not all of our patients have good hygiene.
True.
Now, if we're going to do beautiful, elegant, elective aesthetic dentistry, let's try to get the patient to get some better hygiene first. So for disease control, for class 3s, sure, we'll do that when the patient has poor hygiene. But if they're going to do elective treatment, I think we have an obligation to at least try to have them go through a disease control phase, show them a toothbrush and say, hey, Jim, this is a toothbrush, okay? Use it. Okay.
Yeah, another question, Dr. Clark, is why don't we need to use a water-based jelly for oxygen inhibition layer? But that has been the old protocol for so long, using oxygen inhibition layer jelly. So in this BioClear system, you don't use them.
No, we have old conversations and we have a new conversation. That is an old conversation. There's about 20 things we don't even talk about anymore. But here's the interesting thing. 3M is our partner with teaching. 3M has researched every single step of the BioClear method. And you can if you'll email BioClear, we'll send you the research. I think we've got 15 research studies showing that all the components of the BioClear method make sense to the chemists. So like I said, there are a lot of old conversations about gluma and all that stuff that basically with injection molding, we started a new conversation.
One more question, sir.
Yes.
How to secure the matrix at the cervical area, especially how does it stay there in that region?
That's another great question. And one of the things that you'll see with this black triangle matrix is that the matrices are self-stabilizing. So it has a very broad contact and then they sit up against each other. So to stabilize the matrix, you don't just have to make it like like wedging it along the gum line actually is not that helpful. I mean, it can be, but it's the stability of the entire shape. So when it slides around the tooth, if you have a contact, it will be perfectly stable. The contact stabilizes the gingival. Isn't that crazy? But when you play with bioclear, you go, oh, I get it. Because the continuous curvature, it puts tremendous strength. It's called a second moment of inertia. Hey, we have a lot of great engineers from India. One of the guys that helped design bioclear was from India. He was a great engineer. What we understand is the second moment of inertia. And so the stiffness imparted in bioclear is because of the multiple curvatures. It's really stiff. So if I have a contact, it's going to seal the gingival margin. Now, if I don't have a contact, I'm in trouble. And so I talked about delayed wedging, where we have to hold the matrix in with our hands. Remember with the peg lateral, there was no contact. With the peg lateral, I'm in trouble. I've got to hold the matrix in carefully. The rubber dam helps to seal it. We put a little flowable on the gingival. We hold the matrices, we cure it, and now it's stable. So if I have a contact, easy. We call it easy peasy here, okay? Easy peasy if I have a contact, if the matrix fits, right? That's why you have to sand the contact and get it subgingivally. If I don't have a contact, yes, I need to do some tricks, okay? And the tricks are the little flowable around the edge, cure that, and then you put the wedge in and do what's called delayed wedging. So that's a good question. It tells me that everyone was listening, so that's good. Apparently you didn't fall asleep. Okay, that's good.
Yeah, Dr. Clark, I think this question has been already answered, but I just wanted your light on this, that you apply the bond, then the flowable, and then the composite, and cure all together.
Yes.
So, this curing which is done, is it completely curing the entire thing, including the bond?
Yes. So this is the question everyone should be asking. So we have two ways of thought with we have a new conversation, okay? Here's the new conversation. Always ask yourself, do I have a large number of freshly cut dentin tubules near the pulp? Yes or no? If you have a large number of dentin tubules that have been cut near the pulp, you have to massage the Scotch bond unisilver or the adhesive into dentin, air thin, and cure that independently. Now on that black triangle, did I have a lot of freshly cut dentin near the pulp? No. On the peg lateral, no. So we do have to take care of dentin because dentin is completely different than enamel. So we have to do our dentin bonding. We air thin that and cure, but then when we injection mold on enamel, think about this. When you do a porcelain veneer and you're bonding to enamel, do you cure the adhesive first? No. Why? You're co-curing the adhesive with your flowable or your luting cement. So when we're bonding to enamel, and 3M did some research to validate this, just to make sure everybody was comfortable, you do not need to cure the adhesive independently on enamel. Did everyone hear that? You do not need to cure the adhesive independently on enamel. And let me tell you something, if you don't use adhesive as a surfactant, you cannot get those kind of margins. Now, if you're cutting GV black boxes like this, okay, you don't need a surfactant. If you're doing BioClear, you need something to wet that area. Just like you use a light body and a heavy body to take an impression, right? You could never take an impression deep subgingivally with heavy body, could you? So it's adhesive as a surfactant, flowable and paste. But if I have dentin, that's a separate step. We take care of the dentin bonding first because that's a completely different animal. Is that clear?
Yeah, that was nice. Thank you, Doctor. Over to Dr. Twinkle.
Sir, I wanted to know that how does BioClear system differ from dual force system as both are designed by you?
Well, the dual force is basically a kind of a sister because I designed both of them. So in the posterior, the dual force has metal matrices, which I don't really use, but the wedges in the separator are very similar. Dual force doesn't have any anterior matrices or any clear matrices. So the heart and soul of the BioClear method is the clear anatomic mylar. That is the key. Without that, we really can't do any of the procedures that we want to do because we don't have the smoothness, we don't have the shape, and we can't do through and through curing. So does that answer your question?
Yes, sir.
Dr.
Okay, good.
Clark, just wanted to understand about the C factor, the stress incorporation, and the shrinkage in these restorations.
So what I want you to do, I'm going to give you the short answer and the long answer to C factor, polymerization, shrinkage. Now, that is today is an old conversation. So, but we want to get past that old conversation. So there's two things I'll talk to you quickly about, and then I want you to make sure and email BioClear, and then we can forward this document that was created by 3M to talk about polymerization, shrinkage, and C factor and those sorts of things. So basically, here's the deal. If you have a boxy preparation, you have a wall, the composite wants to pull away, doesn't it? So you have a boxy prep with C factor, it pulls away. It has a lot of tension while the composite cures. With BioClear, because we're going around the tooth, it's actually, the compression is that we're actually creating compression with BioClear. So our C factor is less than 1. So we're actually researching and feel quite strongly that with BioClear, the polymerization shrinkage, because the C factor is less than 1, is a good thing. Who would have thought that polymerization shrinkage was helpful? But on a black triangle or a Clark class 2, where we have a clear matrix and we can allow the composite to go around the tooth, now we don't have to worry about polymerization shrinkage. Now, if we're deep in the tooth, yes, we need to worry about some C factor, and that's why we use some deep in the tooth. Sometimes we'll use a little boat-filled flowable, like in an endodontic access. But when we do the final injection overmolding, our C factor is so favorable that we don't need to layer. And so a lot of those old conversations can go away. We still need to worry about shrinkage and C factor, but if we control the C factor, the shrinkage is our friend.
Dr. Twinkle?
Yes, sir. Sir, can these composites, BioClear concept can be used in posterior teeth?
Yeah, we just didn't talk about posteriors today. We have a tremendous, that's the thing I think I enjoy the posteriors just as much as anteriors. So we have a complete curriculum on the posteriors. We've had a few folks come from India for all of the certification training, and I know they're doing some courses in India, but there's a complete curriculum for the posterior that's very important. And it shares some of the things that we learned about today, but we have these beautiful biofit matrices in the posterior that are what's called HD, and those are key to changing from a GV black prep to a modern Clark class 2 with the negative C factor and all that sort of thing. So it all comes as a formula. You can't just do one thing, I don't think. People that just change one thing, like they use the matrix, but they don't change the prep, or they try and do it with a metal matrix, or it's kind of halfway. Some of those doctors have so much problems, it was almost better that they just stayed with what they were doing. Just cut a boxy prep and use a Toffelmeyer and a wooden wedge, right? I mean, people that go halfway to the BioClear method, I think get frustrated. I think the people that have the most success will implement each part of this new Venn diagram, because every part of what you saw today is the opposite of what we used to do, right? It's the complete opposite.
It's
good questions.
Yeah, it's been a great experience, doctor. And you just opened a new way of, showed us a new way of working. I'm sure this has given a lot of value to our delegates, and we will be looking forward for more interaction from you in the future. So I would request Dr. Twinkle to please formally thank you on our.
So there is one question before I actually formally thanks you. Sir, will this cause sensitivity if the enamel is very thin?
We're going to have no sensitivity if we're bonding to enamel. Anytime we're bonding to dentin, there are 10,000 dentin tubules per square millimeter, and each dentin tubule has a nerve dendrite. No wonder our job is a little stressful, right? If you're playing with dentin tubules, you may have some sensitivity no matter what you do. Now, with the BioClear method, if we really spend time massaging the Scotch-Bond Universal, your adhesive into dentin tubules and curing that, we'll have less sensitivity. One of the great things about the BioClear method is we're not cutting mechanical retention. What happens when you cut mechanical retention? What are you doing to the pulp? You're making the pulp angry. Okay. Don't make it angry. Okay. It's like my wife. The key to a happy life is a happy wife. Okay. Or a happy husband. Okay. Don't make the Pope mad. Why would you argue with your wife? Okay. Why would you argue with the Pope? Don't argue with the Pope. So treat the Pope with love. Okay. Don't cut into Denton. Don't cut mechanical retention. So yes, we're still dealing with sensitivity, but in my practice, it's 95% reduced. But it's still the Pope. It's still the Pope. Sometimes he gets mad.
That's great, sir. I have been using BioClear since past 2 years, and it's completely changed my practice for sure. Dr. Pratik Gupta introduced me to the practice of BioClear, and he has really changed this. He's done it from you. So BioClear is not just composite, it's actually a concept which people need to understand. What you said is correct. No, doing half-heartedly is no point. But it's really revolutionized the practice. It is totally patient-oriented, and it is your follow-up speaks volumes for it. Okay, composites do last, actually, if you follow in the correct way, BioClear way. Sir, on behalf of IACD, I thank you very much for giving us your precious time. And on early morning, 7:30 a.m. Although it's quite late in India, so it's 9:30 in India, late night. So, but thank you very much, sir, for all the time, everything. For all the videos were excellent for the live demo. Thank you. Thank you, sir.
Thank you.
Sir, this is your certificate in appreciation. We will mail it to you, sir.
All right. Thank you. Now,
Thank you, sir.
Just one thing.
Yes, sir.
Everybody in India thinks that I have an E after my Clark. There's no E.
Okay.
You got to fix the certificate.
Yes, sir. We'll change it. We'll say this is virtual, so we'll change it definitely and mail it back to you, sir.
That's fine. Everybody does that. Everybody thinks there's an E. So yeah, no E.
Okay, sir. Okay, sir.
All right.
Thank you.
All right. Thank you so much.
Thank you.
Good day, sir. Good day, sir.
Good day.